We are still waiting on MRI results from Boca Raton native Jozey Altidore after he hurt his hamstring during yesterday's World Cup game against Ghana. Right now, we don't know if he'll be able to play with his U.S. teammates in the remainder of the World Cup. Dr. Jonathan Hersch is an orthopedic surgeon who deals with sports injuries at West Boca Medical Center. Dr. Hersch, thanks for joining us today. We saw in a video just a moment ago, right before it ended, Jozey went down in severe pain. From the looks of it, it looks ominous, but your reaction to this, although we are waiting for those results to come back, what do you gauge as what the problem is right now?
Well, from the looks of the way Jozey went down, it's very typical. When you tear or strain a hamstring, it's usually in mid-stride like he did. And the amount of pain he looked like he was in, taken off on a stretcher, looks like a more severe version of a hamstring strain.
Let's go to our prop here. Obviously, we're dealing with the front area here in the front of the leg, right?
In the back, actually.
Back of the leg.
The hamstring is a large muscle. It actually crosses the hip joint, so it starts at the pelvis and crosses the knee, which is why it so commonly tears when you're sprinting, because it actually has to control the hip and the knee at the same time.
We talked beforehand here, these are obviously professional athletes, their recovery is a bit different. Rate the scale of a hamstring strain here. There are different measures of a hamstring.
Sure, a grade 1 would be a mild strain, something you may get just stretching prior to a running event. A grade 2 would be more of a partial tear, let's say, and a grade 3 would be the most severe. The muscle actually tears completely, or even a tendon could avulse from the bone. It looked from the video, looked like maybe more of a grade 2 or grade 3, but that's what it looked like.
And what's the recovery for those?
Well, for the more severe, in most athletes, you're looking at weeks, maybe even months. So the jury's still out on him, where it lays.
I guess we will see at this point when those MRI results come back to determine at that point where the degree of the injury is. But do you feel like if it's minor, he could be back into the World Cup?
I think he can. I mean, the amount of treatment that he'll get, he'll be icing, he'll be resting, certainly the world-class care he's going to get, certainly hopeful.
All right. Dr. Jonathan Hersch, appreciate your time today, sir. Thank you very much. Kelly.
Jay, thank you. A father and son